I stared at my phone screen in the pre-op room, reading my mother's text message for the third time. My hands were shaking slightly, not from fear of the upcoming surgery, but from the cold reality of their abandonment. We have more important patients at the clinic. Handle your surgery alone. Stop being dramatic. My emergency appendectomy was scheduled in 30 minutes. As fellow doctors, my parents knew exactly how serious this was. Yet their private clinic's wealthy patients apparently took priority over their own daughter. The nurse touched my shoulder gently. Doctor Mitchell, we need to prep you now. Is your family on their way? I managed a small smile. No, they have other commitments. I didn't mention that those commitments were routine Botox injections and elective procedures at their exclusive cosmetic surgery clinic. But, they're doctors, she said, confusion clear in her voice. Surely they understand this is emergency surgery. They understand perfectly, I replied quietly, handing her my phone. They just have different priorities. As she helped me into the hospital gown, I thought about the last family dinner 3 days ago. Mom and Dad had spent the entire evening bragging about their clinic's wealthy clientele and lamenting my choice to work in a public hospital's trauma center. Real doctors don't waste their skills on charity cases, Dad had declared, swirling his expensive whiskey. We built our practice serving people who actually appreciate premium care and can pay premium prices, Mom had added with a knowing smile. Speaking of which, Mrs. Harrison is coming in tomorrow for her third facelift. That's how you build a proper medical practice, dear. I'd kept quiet, not mentioning the 3 lives I'd saved that week in emergency surgery. In their world, status and profit margins mattered more than actual patient care. The anesthesiologist came in to start my IV. Dr. Mitchell, I've reviewed your charts. Everything looks straightforward, but I'm concerned that none of your emergency contacts are responding. Hospital protocol requires. I understand the protocol, I cut in gently, but my parents have made their choice clear. Please proceed with the surgery as planned. He frowned, making a note in my chart. I'll need to document this. Patient abandonment by family members who are licensed physicians. It's concerning from a medical ethics standpoint. I closed my eyes as the initial sedative began flowing through the IV. Do what you need to do. The last thing I remembered before drifting off was the anesthesiologist's voice. This isn't right. I'm filing a report with the medical board. Hours later, I woke up in the recovery room. The surgery had gone well, but I was alone. No worried parents hovering over my bed. No family members asking about my condition. Just the regular hospital staff doing their jobs. My nurse, Maria, checked my vitals with barely concealed anger. Your parents called once, asked if the surgery was finished because they had a dinner reservation at 7. I wasn't surprised. Did they say if they're coming by later? They said they'd try to stop by tomorrow between appointments. She adjusted my pillows with more force than necessary. I've been a nurse for 20 years, but I've never seen doctors abandon their own child during surgery, especially when they work 5 minutes away. I touched her hand gently. It's okay, Maria. I'm used to it. Well, you shouldn't be, she replied firmly. And neither should the medical board. That got my attention. What do you mean? Your case has caused quite a stir. Apparently, several staff members filed formal complaints about patient abandonment and ethical violations. The board is reviewing your parents' licenses. I lay back, processing this information. My parents had spent decades building their prestigious private practice. Their medical licenses were everything to them. They're going to be furious, I murmured. Maria checked my IV with a satisfied smile. They should have thought about that before abandoning a patient in need of emergency surgery. The fact that the patient was their daughter makes it worse, not better. She was right, of course. As doctors, they had sworn the same oaths I had. Their behavior wasn't just personally cruel, it was professionally unethical. My phone buzzed on the bedside table. A text from Mom. Dinner was lovely. Hope your little procedure went well. Try not to make such a fuss next time. I put the phone down without responding. Let them enjoy their dinner. Tomorrow would bring a very different kind of conversation. As if on cue, my phone began ringing. But it wasn't my parents. It was an unlisted number. Probably the medical board starting their investigation. I smiled slightly as I drifted back to sleep. Sometimes karma had perfect timing. The first hints of dawn were creeping through my hospital room window when all hell broke loose. My father's voice echoed down the hallway, his usual smooth bedside manner replaced by barely controlled rage. What do you mean our licenses are under review? Do you have any idea who we are? I pressed the morphine button, not for pain, but in preparation for what was coming. The door burst open, revealing both my parents in their designer medical coats, looking distinctly disheveled. What did you do? Mom demanded, her perfectly Botoxed forehead attempting to wrinkle. The medical board called at 6 a.m. They're investigating us for patient abandonment. I adjusted my bed to sitting position, taking my time. I didn't do anything. The hospital staff reported it. This is ridiculous. Dad spat, pacing the small room. We were with important patients. Mrs. Reynolds was having her fourth rhinoplasty. We couldn't just reschedule. Emergency appendectomy, I said quietly. Potential rupture. You both know the protocol. As licensed physicians, you had a duty of care, especially to immediate family. Don't quote medical ethics at us, Mom snapped. We built one of the most prestigious private practices in the city. Our patients pay premium rates for our undivided attention. And your daughter? I asked, maintaining my calm. What rate should I have paid for basic medical support during emergency surgery? That made them pause, if only briefly. You're being dramatic, Dad waved dismissively. You had a whole hospital of doctors. You didn't need us holding your hand. A knock at the door interrupted his rant. Dr. Sarah Chen, head of the hospital's ethics committee, entered with two colleagues, Dr. and Dr. Mitchell. She nodded coldly to my parents. How convenient to find you here now, after the surgery is complete. Mom stepped forward, switching to her professional voice. Dr. Chen, there seems to be a misunderstanding. No misunderstanding, Dr. Chen cut her off. We have documented evidence of patient abandonment. Text messages showing you were aware of emergency surgery requirements. Multiple witnesses confirming you chose elective cosmetic procedures over your duties as both doctors and parents. Our private practice, Dad began. Your private practice, Dr. Chen continued, is now under full review. Patient records, billing practices, procedure justifications, everything. The board is particularly interested in your pattern of prioritizing wealthy elective procedures over emergency care requirements. I watched my parents' carefully constructed world begin to crumble. Their reputation for exclusive premium care was about to be exposed for what it really was: ethical violations wrapped in luxury packaging. This is your fault. Mom turned to me, her professional mask slipping. After everything we've done for you, done for me, I finally let some emotion enter my voice. You abandoned your daughter during emergency surgery to perform a nose job. That's not parenting. That's not medicine. That's just profit chasing. The board hearing is next week, Dr. Chen stated firmly. I suggest you both prepare thoroughly. Your licenses and practice privileges are at stake. After they left, my parents stood in silence, finally seeming to grasp the gravity of their situation. We can fix this, Dad said eventually, switching to negotiation mode. Tell them you don't want to press charges, that it was all a misunderstanding. I looked at them both. Really looked at them. Their expensive clothes, their perfect appearances, their complete disconnect from real medical ethics. No, I said simply. I won't lie to protect you. Not this time. You would destroy your own parents' careers. Mom's voice shook. You did that yourselves, I replied. Every time you chose money over medicine, every patient you turned away because they couldn't afford your premium rates, every ethical violation you justified with profit margins. We gave you everything, Dad exploded. Except what mattered, I said quietly. Now please leave, I need to rest. Unlike a rhinoplasty, emergency appendectomy actually requires recovery time. They left, already on their phones with lawyers. I knew this was just the beginning. There would be pressure, threats, guilt trips, and probably attempts to discredit me. But for the first time in my medical career, I felt completely certain of my path. Sometimes healing requires exposing the infection first. I pressed the call button, and Maria appeared promptly. Need anything, Dr. Mitchell? Yes, I smiled. Could you please send in the medical board investigators? I think I'm ready to make my official statement. The medical board hearing room was packed. My parents sat at the front with their legal team, while representatives from various hospitals and medical associations filled the gallery. My recent surgery incisions still ached, but I sat straight-backed in my witness chair. Dr. Emily Mitchell, The board chairman began. Please describe the events leading to your emergency appendectomy. For the next 30 minutes, I detailed everything clinically and precisely. The diagnosis, the urgent surgery requirement, the text messages, the abandonment. I presented the facts as I would a medical case study, letting the evidence speak for itself. And your parents, both licensed physicians, working less than 5 minutes away, chose to continue with scheduled cosmetic procedures instead. The chairman clarified. Yes, I replied. Specifically a rhinoplasty revision and routine Botox injections. The murmurs in the room grew louder. Even in the cutthroat world of private practice, this level of ethical violation was shocking. Dr. and Dr. Mitchell, the chairman turned to my parents. Your defense. Their lawyers stood, smooth and practiced. My clients maintain that as private practice physicians, they have obligations to their scheduled patients. Dr. Emily Mitchell had access to full hospital care. No medical negligence occurred, except for the fundamental violation of the Hippocratic Oath. I interjected quietly. First, do no harm. The room fell silent. Furthermore, I continued, meeting my parents' eyes, this incident represents a pattern of behavior. I would like to submit additional evidence. My parents' faces went pale as I handed over the files I'd been gathering for years. Patient rejection records based on income. Unnecessary procedures recommended to wealthy clients. Insurance inflation schemes. You kept records. Mom whispered, horrified. I'm a doctor, I replied simply. Documentation is essential. The board spent hours reviewing the evidence. My parents' lawyer tried increasingly desperate arguments about context and standard private practice procedures, but the facts were undeniable. Finally, the chairman cleared his throat. The board has reached a decision. Dr. James and Dr. Margaret Mitchell, your medical licenses will be suspended for 1 year. Your private practice will be placed under external supervision for 3 years following reinstatement. Additionally, you will be required to provide 500 hours of pro bono medical service at public hospitals. Dad jumped up. This is outrageous. We'll appeal. I wouldn't, the chairman advised coldly. This ruling is lenient considering the evidence. Push further, and we'll launch a full criminal investigation into your billing practices. As the room cleared out, I remained seated, feeling the weight of the moment. My parents approached, their anger now mixed with something else. Fear. Happy now? Mom's voice cracked. You've destroyed everything we built. No, I corrected her gently. I've given you a chance to remember what being a doctor really means. 1 year to rediscover why you took the oath in the first place. We don't need ethics lectures from you. Dad snapped, but his voice lacked conviction. Actually, you do. That's exactly what you need. I stood carefully, mindful of my healing incision. When you're ready to be doctors again, real doctors who care about healing people, not just profits, come find me at the hospital. The public hospital. Mom looked horrified. With those people, I said firmly, are called patients. And yes, that's where you'll find me, doing what doctors are supposed to do, helping people who need it, regardless of their bank accounts. I left them standing there, their perfect world shattered. Outside the hearing room, Dr. Chen was waiting. Well done, she said simply. That couldn't have been easy. It wasn't, I admitted. But sometimes the hardest procedures are the most necessary. Speaking of procedures, she smiled. We have an opening for a new surgical attending at the hospital. Someone who understands medical ethics and isn't afraid to enforce them. Interested? I thought about my parents' prestigious private clinic, with its marble floors and wealthy clients. Then I thought about the emergency room, where I worked, where every day brought new challenges and real opportunities to help people. Yes, I said. I'm very interested. As we walked out, my phone buzzed with messages from my parents' wealthy patients, expressing shock and outrage at the board's decision. I deleted them without reading. Some injuries required radical intervention to heal properly. My parents' ethical infection had been festering for years behind their facade of success. The treatment was harsh, but necessary. Now the healing could begin. Whether they chose to learn from it was up to them. But I had patients waiting, real medicine to practice, and for the first time in my career, I felt completely clean.